Hi everyone! Today I just want to share with you a small practice that can help you with back pain. So I have a pelvic structure here, and you can see that the pelvis is made up of three main parts. So there are the two pelvic half, these are called the ilium, and then there is this structure in the middle is called the sacrum. And the sacrum consists of 5 fused spines, and of course it is then connected to your lower back, your lumbar spine. So I'm just going to show you real close that there is a joint here, here, and of course if you turn around, this is articular surface, is also part of the sacroiliac joint. So in our daily life, we are often called upon to do things that are one-sided, which is also why we have a dominance on one side. And we also have a dominance on one leg. So by walking or doing stuff or even sitting, crossing your legs, for example, which many people do, can actually kind of create some imbalances around the SI joint that can also affect how the integrity of the spine. So because it's really just one bone trying to balance two sides, right? One thing that has happened in our culture, in the amount of time we have to sit and the way we sit, means that our pelvis tends to go into a posterior tilt. So we end up sitting on our tailbone and our sacrum rather than landing on the sit bones themselves. So very simply, we're just going to explore how we can find the integrity in weight bearing through our sit bones rather than having to kind of slouch and sit on the tail. Okay? So you need a strap, and you can use a canvas belt or even a scarf, and you need a block. Okay? It is really quite simple if you can follow the way I'm guiding you to tie this strap. This strap needs to be pretty long to go around the whole pelvis. Or if you don't have a strap that's long enough, you can actually join two together or find a really, really long scarf or really long belt. Okay? So I'm going to show you how to put this belt on. It's a cross belt that will give you some pelvic stability and also gives you feedback on how your pelvis is moving in relationship to the rest of your body. Okay, so you're going to take the buckle side, and I'm right-handed, so I'm going to place it on the right hip point here. There's a little bony structure here, or bony landmark is called the ASIS, anterior superior iliac spine. On the pelvis, it is right here on this point. Okay. So I'm going to place it here, and then I'm going to wrap the strap around the back of my pelvis and feel where the sacrum is. Okay, so I'm going to just wrap it around and come around to the other side of the bony structure of the hip point. And here I can perhaps take a little felt sense on if one side is higher than the other, if one side is closer to the midline than the other. So I can feel that for my structure, my right hip point is slightly higher and slightly closer to the midline. So I'm slightly internally rotated at this moment on the right hip as compared to the left. So these are just little observations you can also notice for yourself. Then I'm going to cross the strap over to the top of my thigh bone here, so where it joins the hip. Okay, so in the hip crease area, and then it goes on here, and then I go around to kind of where my sit bones are, and then the strap comes back around here. So I've got the strap on now, and I'm going to just move around a little, maybe do a little hip rotation. The point here is that I want to find the articulation of my leg bone, so my thigh bone, the top of my thigh bone, in relationship to my pelvis. Okay, so many of us move with the hip joint pretty locked, and when there is no differentiation between the pelvis and your leg bone, you're going to really overcompensate with your spine. So here I'm just doing a little hip rotation and feeling how the leg bone is rotating around the hip joint. This is very important in the ability to find your sit bones, and so you're not sitting on your spine, you're not weight bearing on your spine. Okay. You can also kind of walk around a little, sensing to the way I am moving. I'm moving across space. So I can feel my right side tucks a lot more as I walk, obviously because it's my dominant side. I'm not sure how much you can really see on the screen, but it is quite obvious from the feedback that I'm receiving. Okay. And then I'm going to take a block. If you don't have a block, you can use a book that is rather thick. What I'm going to do is to actually balance on it. Okay. I'm going to slowly step on the block. What I'm doing is actually offering my weight from my back foot to my front. And here I'm noticing the trajectory in which I am weight bearing on my foot. Whether my foot collapses inwards, where there is a pronation and my arch collapse. If there is a certain pathway that is traveling to, if my knee starts to come inwards. Okay. And then when I get onto the block, I am actually going to stay here for a bit and try to balance. Okay. So what happens is that this balancing act, even though the distance from the block to the floor is only a short distance, but many people that I work with then they tense up by locking the knee. Okay, once you lock the knee, the pelvis is tucked. I'm going to go sideways so you can see. Stepping on the block now. Okay, I'm keeping my knee soft at the moment. But once you lock the knee, the pelvis is tucked. And there is a lot more slack here, and the front gets the strap becomes tight. So I want to be able to feel that I can still articulate my hip joint. Okay, try the other side. I'm going to turn this way for you so you can look at the differentiation between pelvis and femur. checking in on how I'm weight bearing. Turn my foot, my left foot, which is the non-dominant side. So it tends to offer some new insights that I don't normally pay attention to. Once again, see, I'm keeping my knee soft. I'm not exactly bending my knee, but I'm not locking it either. The difference between keeping it soft and locking it. So how can we have our legs straight without locking into the knee, into the hip joint, and into our back? Perhaps I can try to find freedom while balancing. Maybe I can do a dancer's pose without locking the knee. Try to do a tree pose. If I were to lock my knee, I might find some semblance of balance, but the thing is that if I fall, I'm going to fall in one piece. Whereas if I were to keep my knee soft, I'm a lot more responsive. So I can play around with the balance a little bit more. You can see I'm much more fluid as compared to locking. Okay? And just coming back. Noticing how I feel at this moment now after doing this little balancing act. And walk around again. Notice if anything has shifted. Do a little hip rotation again and notice if there's more fluidity. And more articulation. I'm going to sit on the block. So you can sit on a chair too if a block is not so accessible for you. I'm going to sitting on the block and allowing my sit bones to land on the block rather than this. Now, if I were sitting on a chair that's higher, it will be easier. I'm sitting on a block. It's a bit lower. It requires a lot more hip mobility and articulation. But the ability to just be able to still articulate pelvis and femur. See how I'm able to kind of move around. Still able to respond. Whereas if I'm on my tailbone, I'm stuck. I think I talked about this in the last bones video. If I'm tucking my tail, my head gets stuck too. It has to come forward. But if I'm on my sit bones, And if you're on your sit bone, you're able to come up. If you're on your tail, there's no way I could get out. Okay, I hope you enjoy this little exploration. See you next time.